Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we're talking about Breastfeeding Week 2023, which is being observed under the theme Enabling Breastfeeding, Making a Difference for Working Parents. Joining me in the program today is Ms. Diakola Gittins, Community Nutrition Officer attached to the Food Policy Division. Ms. Gittins, welcome to our program today.
Thank you for having me.
So we're in Breastfeeding Week under the theme Enabling Breastfeeding, Making a Difference for Working Parents. So first off, we want to talk a little bit about some of the plans that the Food Policy Unit has for this week's observance.
Okay, thank you. So for Breastfeeding Week, we have quite a number of plans. We have a symposium at Regency where we will be having parents, colleagues from the health sector. We'll also be inviting some school children to talk about breastfeeding and its benefits. We have health fairs, we have health walks, we have panel discussions, we have question and answer segments where persons will be able to answer questions and win lovely prizes for Breastfeeding Week.
Wonderful. I'm so excited to hear about all these things that you guys have planned for this week. I'm definitely looking forward to it. For mothers and even fathers who are viewing our program today, what can they expect this week of breastfeeding? What do you want them to take away during this period?
What we want parents to take away and the country at large is that breastfeeding is the best that you can give your child. That is the best start in life any parent can give to their child. So we encourage parents to breastfeed.
Wonderful. Now you said that breastfeeding gives the best start in life. Could you tell us about the importance of breastfeeding? Why is it important for both mommy as well as daddy?
Good. So breastfeeding has many benefits, Elisa. It has so many benefits, I don't think we have discovered all of them. So I'm just going to list a few, some of the ones that we usually give to persons. So when a mother decides to breastfeed, is when she gets her baby, within that first couple hours after delivery and she breastfeeds, she produces something called colostrum. That is the first milk that the baby is going to get. That milk is rich in antibodies and it protects the child from any infections and so on. So that is where we say it's the best start you can give the baby. So it protects babies from infections like diarrhea, vomiting, ear infection, cold infections. And that milk also works as the baby's first immunization until the baby gets to clinic and receives their vaccines and so on. So you're protecting your baby through her breast milk.
Wonderful. So we know that apart from the family, there are also society. Society could benefit as well, and the environment. Tell us how this is possible.
So the environment benefits from breastfeeding because when mommy breastfeeds, there is no cans to discard of, so we will be saving the environment. To get the cans to move from point A to point B, we have to use vehicles, and vehicles.
Yes.
So there is no transportation cost factor there. So we will be saving the environment. We will be protecting the ozone layer because it's being destroyed every day. So the less transmission of moving infant formula from point A to point B, there is none of that, and she breastfeeds the baby. And the thing about breast milk and babies is that breast milk changes from the time the baby is born to whenever she decides to stop or baby decides to stop breastfeeding, because the milk that she produces today will not be the same milk that she's producing tomorrow because the child is growing. No other milk can do that for that baby.
Wow, so indeed, breast is best. Could you highlight some of those steps towards successful breastfeeding?
Good. So for successful breastfeeding, you will have to take certain things into factor. You have to look at the baby's position, because if the baby's not positioned well, the baby won't be able to breastfeed.
Wow.
You have to also look at the baby's attachment. So we have to ensure that most of the darker part on the breast, that's the areola, most of that darker part is in that baby's mouth, so the baby will be able to get a full mouthful of breast milk. Lovely breast milk, and I usually call it the liquid gold.
The liquid gold, I love that. What is the role of the father in the breastfeeding process? Because we know that though mommy will be giving the breast to the baby, we need the support of the fathers as well. So could you highlight or explain to us how important is his fathers along this process?
Now, daddy's role is much as important as mommy. So when mommy is there breastfeeding, we want him to support her in doing other things around the house, because in fact it takes time to breastfeed and to breastfeed successfully. So she cannot be breastfeeding and then have to wash and cook and clean, and if you have the other children around. So we will want daddy and granny and auntie, because we know the family loves the baby. So instead of them taking the baby from mommy and so that she can do the work, just allow mommy and baby to be together.
Yes.
And help out in other areas. And encourage her, support her, tell her how proud you are of her wanting to breastfeed this baby.
Wonderful. In keeping with our theme this year, we want to touch a bit on breastfeeding and working parents. Because I know for parents who are working, it's a bit difficult, more challenging, right? In this case, what can organizations and workplaces do to help support the parents breastfeeding?
I love that question. So for workplaces, we want you to support mothers by creating safe spaces, because one of the things we usually tell persons, mothers especially, is that they can express their breast milk.
Yes.
So we want them to create places where mommy can go in a nice, clean, safe corner, so that she can take out the breast and be able to express the breast milk, so the baby will always have an adequate supply of breast milk.
Definitely.
And sometimes we will want them to be a little lenient, that if she wants to leave and go for an hour, especially during our lunch hour, to breastfeed and so on, they can encourage that. For workplaces where there are daycares, and we would love for more workplaces to open up daycares, that they can bring their baby to work, and she will be at a little bit more ease to know that her baby is right downstairs or right on the middle floor or something, that she can easily run and breastfeed baby.
Wonderful. Thank you so much, dear Kola. With regards to breastfeeding, the length of time, could you emphasize a little bit more on that?
So WHO's recommendation, as the World Health Organization, they recommend that we breastfeed exclusively from birth to 6 months. So from the time the baby is born to when the baby completes 6 months, that baby should only be given breast milk alone.
So no formula?
No formula, no water. I know the days are hot and so on, but if we feel that baby is hot, and every mother gets to learn her child.
Yes.
If you feel baby is hot, the baby is thirsty, all she needs to do is take out the breast and give the baby the milk, because the breast milk has all the nutrients that the child needs in adequate amounts from birth to 6 months. Secondly, the child's stomach before 6 months is not developed to work on anything else, right? So from birth to 6 months, exclusive breastfeeding. After they would have completed 6 months, that's when they're going into their 7th month, we introduce foods from the family pot with continued breastfeeding for 2 years, or as long as mommy and baby are comfortable breastfeeding. So mommy, if you're comfortable breastfeeding 5 years, I say go ahead, because breast milk produces a lot of nutrients for that child. So if you have a 18 months child, you know, sometimes when we fall ill, we don't want to eat, right? But most of those children, when they're ill, they go to mommy for comfort, they go to mommy for the breast milk, and they will be getting nutrients to help them recover from whatever illnesses that they have. Another thing is that breastfed children are rarely ill. They are happy, they're healthy, studies have shown that those children perform better in school. So when they come out of schools, those children will be able to be getting the better paying jobs. And every parent wants their child to be better than them.
Indeed. I know that the unit has been promoting healthy living and healthy eating habits and so on. What should be the diet of a breastfeeding mother?
So the diet of the breastfeeding mother isn't different from any healthy diet that we promote. All she needs to do is to make sure that she drinks a lot of water and to use foods from the 6 food groups daily. Ensure she has her vegetables, her fruits, her legumes, her food from animals, if she uses food from animals, her staples, and that's it.
Thank you, Deacola. So, Ms. Gittins, what can we look forward to in the years ahead and even the months ahead from the Food Policy Division?
Well, we will be definitely pushing more education as it relates to breastfeeding, and we would really love for the population at large to buy into breastfeeding, because once a child is breastfed, like I said earlier, that child will not fall ill, so parents don't have to take the child to hospital, and yet we will spend less monies on buying medication for childhood illnesses that can be prevented where breastfeeding is related. So in a long-term effect, it can save the country millions of dollars. So breastfeeding, again, is best. It's good for mommy, baby, family, country at large.
Thank you so much, Deacola, for joining me today on the program. And I want to encourage you guys to keep up the good work that you've been doing at your units.
Thank you.
The best gift of love a mother can give to her child is to breastfeed her baby. And the best gift of love a father can give to his child is to support the mother of his child to breastfeed. Breastfeeding has many benefits for not only the baby, but for the mother, the family, and the environment. Breast milk is the baby's first immunization, baby's first line of defense. It has all the nutrients and antibodies your baby needs. Breastfeeding also builds a strong bond between mother and baby. Breast milk is safe and protects your baby against illnesses such as ear infection, diarrhea, pneumonia, rotten teeth, respiratory diseases, and many other illnesses. So mommy and daddy, ensure your baby breastfeeds exclusively for the first 6 months of life and continues to breastfeed until your child is 2 years of age and beyond. Remember, breast milk gives your baby the best start in life. A message from the Food and Nutrition Policy Division, Ministry of Health.
This week, Guyana joins our sisters and brothers across the world to observe and to celebrate World Breastfeeding Week. We join from the very inception when the world realized that breastfeeding is one of the best ways possible to ensure child health and child survival. A child that has been exclusively breastfed for the first 6 months of their life grow up to be healthier, is protected from various diseases. A newborn child breastfed from the inception is protected against many infectious diseases because the mother's breast milk has many antibodies that the baby does not yet have that protect them against many existing pathogens. But a baby that is breastfed exclusively for the first 6 months grow up to be protected against many chronic diseases such as diabetes. A baby breastfed exclusively in the first 6 months grow up to be an adult that have less of a chance of having diabetes. A baby that is breastfed exclusively for the first 6 months have a greater proficiency in terms of intelligence. They do better in schools. They have fewer incidences of ear infection, etc. So it is a no-brainer. Babies breastfed are healthier in life. They are less likely to be overweight, for example. But it is not just the baby that benefits from a mother breastfeeding them exclusively in the first 6 months. A mother that breastfeeds their baby is likely to also benefit. Research has shown that women who breastfeed their babies are less likely to develop cancer, are less likely to develop diabetes. So there are very good reasons why we should breastfeed our baby, both for the baby's sake and for the mother's sake. And if a country is able to promote breastfeeding among most babies, that country will benefit also because there are less healthcare costs in the future. There is no reason why a country should not embrace breastfeeding within the first hour of life, within the first 2 days of life, that the baby should be exclusively breastfed. And no reason why we shouldn't have exclusive breastfeeding for the first 6 months of a baby's life. It is therefore a little bit disappointing for me that more than 20 years after we joined this movement for better health for our babies and for our people, that Ghana is still struggling at about 40% for exclusive breastfeeding. And yes, I do know that we have about 50% of our babies that have a mixture of breastfeeding and other substitutes. But we need to increase. We need to ensure that all our babies benefit as far as possible. And so this week, as we observe and we celebrate the fact that about 40% of our babies do benefit from exclusive breastfeeding, we must remember this, that about 11% of our babies have almost no breastfeeding, and that is unacceptable. We must recommit this week. So I appeal to mothers across the board. I appeal to our doctors, our nurses, our pastors and our priests, our pandits and our imams. Let us all work together. I appeal to our employers, to our NGOs. This is a national need. This is a national priority. We must work together to ensure that no baby is left behind, that every baby has an opportunity to benefit from exclusive breastfeeding. To our public health workers, the nurses, the leaders in our maternal child health care, we must ensure that every pregnant woman in every antenatal clinic, both in the public sector and the private sector, benefit from counseling so that they accept and embrace exclusive breastfeeding. I hope that in a few short years from now, we will move from 40% exclusive breastfeeding to greater than 50%, and that by 2030, greater than 60% of our babies are benefiting from exclusive breastfeeding. It will be better for our children, better for our mothers. It will create a healthier population, and we can live longer, more productive lives. So let us all recommit ourselves this week.
Thank you for joining me on the Health Matters program today. I'm Alicia Martin saying goodbye for now.